can't imagine having to practice in a system where I couldn't provide them the absolute best care I could because they can't afford to pay for it.
Doctors in Canada have complete freedom to do whatever they think is appropriate to provide the care for the patient that they're sitting in front of.
It's really simple, actually. Every Canadian gets access to healthcare coverage. Practically, you get a card which has a health insurance number on it, and you can go to whichever doctor or hospital you'd like to go to. You present your card before you have a doctor's visit, and they will bill the government for healthcare services. There's no co-pays, there's no user fees.
What the government does in Canada is it pays for healthcare. So our government is the payer, and we have a single payer, and they'll pay for whatever medically necessary procedures or visits or health services patients need.
Dealing with a major illness is really stressful, and a benefit of universal health insurance is that it can take away the economic stress of dealing with that illness.
I see patients in the emergency department who have serious conditions and I think they might need to have surgery right away. When I see a patient like that in Canada, I put them on the operating room list and I can do that operation right away.
In Canada, if you have to go to the doctor or go to a hospital, say for surgery, you never have to worry about paying for any of the services up front. You never have to pay co-pays or deductibles. You never have to argue with insurance companies about whether or not your surgery is going to be covered. You never have to worry that you're not going to be able to see the doctor that you want to see. So you're going to have comfort knowing that when you need it, care is going to be there for you and it's not going to bankrupt you or your family.
I've worked in the US for a period of time when I was doing my training, and it doesn't work the same way there. I can decide that a patient needs a procedure, but we still have to look at what their insurance coverage is, whether the specific procedure has been approved. We still have to get permission for that, and you don't always get permission to do what you think is right as a doctor. And to me, that's unconscionable. I don't understand why Americans accept that.
I don't have to worry about whether or not they have insurance. I don't have to talk to insurance companies.
I don't need to get pre-approval. I don't have to speak to a bureaucrat in some insurance company about whether something's pre-approved or whether my patient's eligible for it, or if I have to do a different type of procedure which might be less expensive. Our system is run by doctors and professionals and people whose only interest is providing the best care for patients. We're not constrained by any other needs. We don't have to extract profits from the system. We don't have to make sure that our hospitals are profitable.
I think healthcare is a human right. As a physician, universal healthcare is great because it makes my life so much easier.
As far as single payer, it works in Canada.